So Gerocare is basically a cloud-based hospital that provides the entire spectrum of primary health care to the elderly in their home. So from doctor visits to drugs at home to tests at home. We see the parents' living room as our consulting room. As such, everything that can be done is provided for them there.
Dr. Ebinabo Ofrey, welcome to Dr. Tosin's surgery. It's been a while. I've been trying to have a chat with you about things, and obviously you're a very busy person with everything going on. For my listeners out there, for those of you that don't know, Dr. Ofrey is a medical doctor. We actually went to school together, but he has been into quite a lot. He has a special interest in geriatric care, that's elderly care. And with that in mind, he's done a lot of innovation and leveraging in the sense that he has formed a company called Gerocare, Gerocare Solutions rather, which has focused on leveraging technology to help care for elderly people. And that's what we're here to talk about, because this type of innovations are the things we need in Nigeria. Just a small background, Gerocare is one of the companies that actually, I think, if I'm correct, last year you guys received an outstanding award for digital innovation? Is that correct?
I think that's this year, earlier this year, just before the whole COVID pandemic.
Wow. Yeah, so for my listeners out there,
I think it was the week after we received the award that the lockdown set in.
Oh, wow. Yeah, so that's because I know you'd been involved in a lot of startup and innovation competitions and things. I think there was a time you were in Kigali, there was another time you were in South Africa, with a lot of things going on.
That's the life of a founder, especially in the early stages.
So if you don't mind, just for the listeners out there, do you mind giving them a brief origin story? What led to where you are at the moment and what's driving your passion?
All right, so Gerocare was born out of a personal need. I'm sure I've told this story quite a few times about the fact that a few years ago, in the space of 1 year, my father had 2 strokes. And that was not because there's nothing I could have done. I was simply in another location at the time. He was in Port Harcourt, I lived in Bayelsa. Then subsequently, my mother called me, telling me her blood pressure was very high, her blood sugar was very high. But that was not even the main thing. She said something that jolted me. She said I had neglected them. And when I heard that, I thought that was impossible. How could that happen? But when I analyzed my life closely, I realized that while focused on business, career, and family, I actually had subconsciously neglected them. We then realized that this problem is not peculiar to me. There are millions of Africans living and working far away from where their parents are. And the only time they hear anything is when something goes wrong. Yeah. And so the question was, is there a way whereby no matter where you are in the world, you can provide for medical care for your parents and also still remind them that you care? And so my co-founders and I came up with Gerocare to solve this problem for myself and for the millions of Africans across the continent experiencing the same thing. So in essence, that's why we started with a personal need that needed to be filled. Unfortunately, the co-founders and I had the unique skill sets to have that done.
Wow. I mean, that's really key here. I mean, like you said, you've told this story many times. I've heard this story, and it hits back home. It hits back home because even I personally have seen a lot of this type of things happen where you're caring for people and you're not close to where your relatives are, and you're trying to offer them help and care. Just for listeners, if you were to explain Gerocare, how it works, can you break it down for the person asking themselves now, Gerocare, what is Gerocare?
So Gerocare is basically a cloud-based hospital that provides the entire spectrum of primary health care to the elderly in their home. So from doctor visits to drugs at home to tests at home. We see the parents' living room as our consulting room. As such, everything that can be done is provided for them there. What we realized was that when you go to a hospital, the only person you really see is the doctor. You don't see the pharmacist, you don't have to see the lab scientist. So the question was, why do you have to be in the same building with them?
Yeah.
So we can transform your living room to the consulting room, and then when the doctor sees you, anything he needs, he's connected to everybody else via their applications. So after reviewing you, if he needs drugs, he makes a request. It goes to a pharmacy network to deliver to you at home.
Wow.
If it needs tests, it makes a request. It goes to a lab network. They send someone home to take the sample. So you have the entire experience of a hospital without leaving the home. So we make it extremely, to get this done, we make it extremely easy for people like you and I to subscribe for care for our parents by simply download the Gerocare application or going to our website. And so you create an account for yourself, you input the details of your parents, and you make a payment. Immediately, they are matched to a medical doctor who lives close by, who begins to visit them at home at least once a month and give you real-time updates wherever you are in the world. So when he gets to the house, he checks in. Wherever in the world you are, London, Paris, or other states in Nigeria, you get a notification that the doctor is in your house. When he's done, he checks out. You know he has left. Then within at most 24 hours, you get a report on how the visit went. If they need drugs or tests, you can pay via your app, and then we deliver to them at home. So at every point in time, you know what's going on with them. So you can look through your application and assess your mother or father's health records for the past 6 months or 7 months, because every month you get a report on how they're doing. So you are never really surprised by any eventuality. Especially as the fact that our parents have what they call a selfless love for us. Yeah. And most times they won't tell us when there's a problem. You only hear much later. Yeah. We had a case whereby a lady who subscribed to us, because a few months ago, her mother actually fell but couldn't get up. So she managed to call neighbors and was able to get to her feet. The next time it happened, there was nobody. So she had to call her daughter. When the daughter got there, she was very surprised. Why did you let it get this far? What's wrong with you? How can you stay alone? She now said, what's the problem? Is it because this time I told you? Now it happens regularly. Oh, there are things that happen that they don't want to bother you. But that day she called her because there was nobody else. But if Gerocare was providing care for this woman, every month she gets a notification that this is the status of the mother's health and this is what she needs to do. So even the drugs and tests, many times, like my mother, for instance, is hypertensive and diabetic. Before Gerocare, at the end of the month, because her pension was little, she has to decide which one she feels is more important to buy a drug. But she has 3 children that can afford these things for her, but she doesn't want to bother them. So with this application, most times you even know when the drug finishes before the parents do, and you're able to refill for them. So each time the doctor gets to the house, they are reminded that you care, because even though you are not there, somebody is being sent regularly to check up on them. So I can go on and on, but let me let me cut it short here.
Yeah, exactly. I think clearly from what you said, a very good statement. It's like the cloud-based hospital. So hospital at home type of thing. You're bringing care to the person. I think that really.
And then the care is not substandard; it's the exact same care you receive in the hospital. So the fact that you're coming to your house does not mean you're losing out on anything.
I think that's a good point to underline for people to hear. The care is not substandard; it's equal or better than what you get in any general or mainstream hospital, because it's isolated care. Person is not that in a rush as you'd see in the hospital, and the environment is much more relaxed. Wow, I think. That's a good breakdown of everything, because we had that looked at the app. I have personally subscribed and downloaded the app. We've not yet implemented care just yet, but like we were talking about how we would get care for some of my relatives.
To that location, yeah.
Yes. So I think going forward with this, I think the next question people were asking was things regarding affordability. How do you plan to address the affordability, and what would you say about that?
Currently, our plan is very affordable.
Yes.
As we like to compare it to the cable networks in Nigeria, and the monthly subscriptions most people pay for their cable networks is much higher than what we charge monthly. So we charge about $6,300 to $6,500 per month, which is about $18 US every month. That entitles you to access to the application and the doctor home visits. So the interesting thing is, like, again, I'm looking into the cable subscriptions in which you have the decoder and then you pay for a monthly access. So our application is like your decoder, but you pay a monthly access to access the doctor visits.
Yeah. I think that makes sense. So a general question to everybody, would you prioritize your parents' healthcare above your cable network subscription? I think that's a good way to put it.
Especially when you understand that it's not a nurse coming to the house, it's not any paramedical person comes to the house, it's actually a doctor that is coming to see them.
Yeah.
Because alternatively, most times they still go to pharmacies and chemists and do all types of things and even spend more in the long run. But this is the price that gets a doctor to come to the house to provide the care you receive in the hospital without the logistic hassles of you going there and coming back, especially if they have nobody to take them. So interestingly, one point I always note is that many times the elderly's conditions deteriorate not because they don't know they're supposed to go to a hospital. But when you think of the hassle of going there, you rather find a cheaper alternative. So mama has a headache. She knows it's quite disturbing, but she considers how much of a hassle it would be to go to a clinic. So they send somebody nearby to go to a pharmacy and get drugs for her. The next month it persists until the point whereby she has a stroke or something drastic. Then she now finally goes. But for 6 months, she had known there was a problem. But after considering the hassles it takes to get to the clinic, to wait in the clinic, for somebody to bring her back, she decides it's better for her to try and do what she can without disturbing anybody. So this also takes the hassle off. So apart from the affordability is the time that is necessary to take them to the clinic and bring them back. Time is spent in the clinic and all that is taken away from it.
Wow. I think that's also very clear, very, very valid point in that sense. So looking at the things, we talked about affordability. I was looking into what are the possibilities where you are now. What are the limitations you faced so far? I mean, given the fact that you are in a very peculiar economic environment called Nigeria. So how have you managed with the limitations? Because from personally, obviously, we know some of the limitations you've gone through, but just to share your experience with budding entrepreneurs who are looking at you and draw some source of inspiration from this.
So I'll provide limitations in two senses.
Yes.
In the sense of Gerocare as a null idea that people are getting to know, and limitations in the sense that you pointed out as regards to being a startup and fundraising and setting up a structure in Nigeria. So as regards Gerocare being a new idea, we noticed that most people in Nigeria, especially as regards to healthcare, are more reactive than proactive. And then they realize that the amount they spend is much more than they would have spent if steps had been taken. So our approach is more of focusing on getting the person to prevent complications and incidents from taking place. And that's why we have a doctor see the elderly every single month, whether they're ill or not, because what they don't consider as an illness may be a pointer to something later on. So just getting there and seeing them and having that discussion goes a long way to prevent other complications. And we need to also get people to understand that the fact that their parents are fine is not a reason why they should delay signing up to Gerocare. I usually give two examples. A family friend, his father passed away a few years ago. It was a normal Sunday morning. He went to church, got back from church, called his friend on the phone. While speaking to his friend, all of a sudden, the friend could not hear him anymore. As usual, we thought it was network being Nigerians, but the man had passed away. But you would say, how could that have happened? I saw this man in church this morning. He actually participated in service. So the question was he fine or was nobody just monitoring him? Because when his blood pressure moved up gradually, there was nobody there. He hits 200, he has a stroke, and they say it was fine. So even if you feel they are at optimal health right now, looking at them, like my father, for instance, before the stroke, he was larger than life. You will not believe that anything could affect him. On the outward appearance, he felt he felt healthy. But things were happening that he had no idea about. So even if you feel they're in perfect condition, that is the best time to begin the Gerocare service to ensure they remain that way. If we get there and we find a problem, also perfect. We found it before any complications arose. Yeah. But if you leave it, things may happen that you will be surprised about. You get calls and somebody just collapsed, but you thought it was fine. So Gerocare, the idea is to begin care even when you feel the person is normal. And that has been one of our main hurdles to get people to sign up. Because you talk to somebody, he says, my father is strong. Yes, he's strong outwardly, but you have no idea what's going on inside. If he's checked up, you can ensure he's strong by actual medical evidence and not by your impressions about how he's feeling. So that has been a key limitation, getting people to start before something happens. when something happens, you cannot get them back to the optimal health. So it's better to start before anything happens. So that's the key. And we've been providing customer education on the need to have preventive care, especially as because the infrastructure in Nigeria is that if something happens, you are less likely to be able to care for the person. So why not help him out when it's just a BP problem before the complications set in? So that's with regards to Gerocare and limitations.
Yeah.
As regards an entrepreneur, interestingly, a few weeks ago, I spoke on an event about the resilience of startups, and we realized that feature or that characteristic of being resilient is the key to surviving as an entrepreneur in Nigeria. Because resilience basically means how fast you can come back from a setback, how fast you can recover from tough times. And that is the entire story of being a startup in Nigeria. Almost every day there are things you need to surmount and come back from. So the key is to ensure that, one, the reason why you are in business must be a reason that you will even, that can ensure you, what's the word? And figure that can ensure you stand the test of time.
Yeah.
In the sense that even if money is not coming, will you still be doing it? Because if you are doing it for money, the moment the money is not coming as you expect, you stop. But as I said, for Gerocare, for instance, the passion is because you actually had a personal problem. So each time I get home and see my father, I know why I'm doing this thing. Yeah. Because if Gerocare was in existence before it happened, it would not have happened. Because somebody will have been checking up on him closely. So each time I get home, I see the reason why I'm doing it. And so whatever business you start, the why must be extremely strong. If the why is strong, everything else will fall in place. You will not say because there is no infrastructure, I won't continue. The question you ask yourself is, the problem you're trying to solve, is it still there? If the problem is still there, then you have to find a way to continue. So once your why is strong, no matter what happens in the environment, you will still be able to push through and succeed.
Right. I think that's the key thing, like you said, resilience and knowing your why. I mean, that shows a lot, to be honest with you, because it takes a lot to do stuff. Because we've all heard of lots of stories of startups who at a point in time got frustrated out just because of numerous things that happened anyway. I think that's another discussion for another time.
Yeah. So let me add something about the fundraising bit.
Yes.
Which is the fact that nobody will give you money if you have not started something and proven that it works. People don't fund ideas. They fund the execution or implementation. They see traction that something can happen. So many times people say, I have an idea, I'm trying to raise funds, I'm not getting it. You will never get it because people that provide funds need an evidence that what you are saying actually works. So no matter how beautiful you think the idea is, if nobody has started paying for it, or at least giving you a letter of intent stating that once you have it, they will buy it, you are not likely to get funding. So first step, before you ask anybody for funds, get some level of traction. Just an idea will not work. At least in Nigeria, I'm sure just an idea won't work. I don't know about other climes.
Yeah, guys, you heard it out there. You heard it from the primary men that do startup themselves, man. People fund execution, not ideas. I mean, that should be the punchline for this podcast, to be honest, this episode. I like that. I really like that. So if we take it slightly forward, I mean, looking towards the future, your scope of expansion, if I liken it to over here, what you've done is you've really modulated healthcare, put it in an app and taken it into the people's home. I know it's focused more, you've talked about doctor care, focusing on the doctor. I was also thinking about what we call ancillary healthcare services. Do you think there is scope in your expansion to involve nursing care or develop like what the thing that is really lacking in Nigeria? One of the things I'm talking about with someone else on paramedic care. Is that something you think you may add towards the end, or is where do you see it going really?
So we currently have those available right now.
Okay.
So we see Gerocare as the one-stop shop for elderly care for now. So no matter what you need, you can get it through us. So we provide medical doctor services as our core, but we are partnered with everybody else you need. So we're sort of like the head of the medical team offline. So we are the first point of call, but we direct you to whatever else you need and mediate the process of you getting the value for money on that end. So yes, you can go out yourself and find a caregiver, but it's better to go through Gerocare because we are already trusted and will ensure whatever price you are paying on that end is value for money. We'll ensure supervision to make sure whatever they're supposed to do, they are doing. So we are in the middle. We provide doctor services, but if you need physiotherapy, we have partners. If you need caregivers, we have partners. If you need drugs, we have partners. If you need tests, we have partners. So we've created a whole ecosystem on everything you may need. We are the point of contact, but everything else you need, you can get through us.
Right. I think that covers everything, really. I mean, so far it's been clear put for everybody. So Gerocare is like the one-stop shop for elderly care, and it's like an app on your phone, a care on your phone for your family. That's been lovely, man. No, so usually on the podcast towards the end, as we're rounding up now, because you've given us a lot of information about Gerocare, if I always do about a set of questions that I talk to people about, and with you, for instance, if you're happy, I could go through some questions and we can ask them, ask the questions. What do you think?
Sure, no problem.
So, like now, one of the things I say, if you had a chance and you could give a punchline to Nigerians to live by, like a statement that has moved you or moved people, what would that be?
If not you, then who?
If not you, then who? Wow.
I think you see a problem and ask yourself, if you don't do it, who will? Because you can't stay there and expect everybody else to do these things. If you're not doing it, it's likely nobody else might do it also. So if you see a problem and you can solve it, don't wait for somebody else. Take hold of it.
Take hold. Wow. Take initiative. Wow. Nice. Now, if you could change one thing about Nigerians, what would that be?
Change one thing. I think it's the basic lackadaisical attitude towards their leadership.
Right. Okay. Lackadaisical attitude towards leadership. Okay. That's interesting. So more the attitude. Towards the attitude towards leadership.
Towards leadership, yeah. So because the leadership, you see how it is, but people seem not to care that much, and that's why it remains that way. Because the people that can do something never vie for leadership, and the people that we don't want to be there are the ones that are there, but nobody's doing anything about it.
Right. So that's it. Rather than just sit down and complain on Twitter and Instagram, do something. Yeah. Okay. Good point.
Keyboard warriors.
Keyboard warriors. Yeah. Cool. And then the last question. Through everything that you've been through, you're obviously a passionate person, a motivated person. Do you have a mentor or an idol that you look up to, and why?
I have quite a few mentors.
Okay.
Because as I tell people, in this day and age, I don't advise you to go into a business without having a mentor. Because people have made all the mistakes you are going to start making. And then your mentor's flaw is your ceiling, because they're starting from where he's right now. So I have mentors in business, but even in various areas of business. For instance, in marketing, you have somebody that is good at marketing. It may not be in healthcare, but the beauty is that he brings a perspective that you don't currently have. If you have mentors only in your industry, the things you do will be similar to other people in your industry. But for instance, I'm in healthcare, but the person that is my mentor in marketing might just be in probably aviation. And so the ideas he gives me will be like coming from left wing for anybody else in healthcare. So you automatically seem innovative. So it's not just enough to have a mentor in your direct industry, but get mentors in other industries in specific areas. So mentors in customer acquisition. For instance, Gerocare is a subscription model. You hardly find that kind of thing in healthcare. So you bring things from outside and then automatically make your business innovative. And I feel that's why Gerocare is innovative, because many of our ideas are outside healthcare, but we bring them into healthcare. So the mentors I have now, I have one in particular who is like the startup guru in Africa, who is Tommy Davis, that points, usually helps a lot in pointing me in certain directions of what to do as group mentorship and one-on-ones when possible. Yeah. We have a primary investor, Kola,
okay,
a ventures platform. Yeah, he's also has been very instrumental in our growth. I always tell people we launched from the Ventures Accelerator program. And if we never went there, Gerocare would never have existed the way it is. Because every single thing I know about startups and the foundation I have is from Ventures platform. They did a very good job, and I usually tell people without Ventures platform, we will not be where we are now. So Kola, I know, is also somebody I look up to, and I get certain advice from. So those are the two people that come to mind. The rest are mainly authors. So I've not had personal interactions with them, but their books have gone a long way to let me know what to do. Especially long before I started the whole startup thing, I was a fan of Brian Tracy and sales. So I learned a lot from how to sell, how to close deals, and do all sorts of things from Brian Tracy, as he has a number of books I follow. There's also a guy called T. Haveka. I attended his Millionaire Mind intensive session in Malaysia to show you how much of an effect he had on me. I actually tattooed the word Millionaire Mind on my arm. I have a large tattoo here from here to here. Saying Millionaire Mind. Because after I left that session, my mind had shifted. So he had an impact on me. That's two books, Secrets of the Millionaire Mind and Speed Wealth, which was like my daily reading when I was in Malaysia doing my MBA. So Haveka, Brian Tracy, and then Tony Robbins.
Tony Robbins, T. Haveka. Yes, those are really great people. That has been wonderful, man. Thank you so much. For my listeners, if anybody wants to follow you on social media or get in contact, what are the best platforms to catch you on, and what are your handles?
So on Instagram, I'm at Gerocare _DR. That's Gerocare _Dr. DR. Twitter, same handle at Gerocare _DR. On Facebook, it's just Ebi Ofrey. I think those are the key platforms, and then LinkedIn is Ebi Ofrey too.
No worries.
Ebi as in EBI. Ofrey. So not Humphrey, not offering. It's Ofrey.
No worries. For people, anybody listening, I will put the links in the show notes for anybody that wants to click and follow you and get some update on what's going on with Gerocare. Thank you so much, Ebi, for coming.
Yeah, so before I jump off, also I need to commend your podcast. They've been quite interesting. I've followed the progression, and they've actually been getting better and better. So keep up the good work. It's quite interesting to see people that you know doing great things.
Thank you so much. Thank you so much. I mean, that's commendable. I think I will use this. You've got a lot of punchlines here I need to use, man, and things for T-shirts. I really like that one. If not you, then who? That's T-shirt worthy, you know. You get that T-shirt. Right. Thank you so much, man. Thank you so much.
All right.